Hi everyone, just want to welcome everyone to our webinar well, tonight actually, it's already nighttime. We'll give everyone a couple minutes just to trickle in here. But I did want to just introduce our panelists while we're waiting for more attendees to come. So we have our CLO and President, Dean McElwain, who will be talking. We also have our National Director of Wellness, Susan Greeley. And then we also have Dr. Ziering, who everyone here knows. So we'll just wait a couple more minutes and then we'll get started. And then just so everyone knows as well, we do have a Q&A. You can put in your questions and we'll try to answer everyone's questions the best that we can. But Dean and Dr. Ziering will be talking and should be answering everyone's questions that I know you've been calling in about and are here to learn about.
I think we'll start in another minute or here or so. So I'll just say hello, everyone, and thank you to all of the folks who've joined us this evening. Many of you are very close and have a long-standing relationship with Dr. Zehring. So we just wanted to thank you all for taking the time to recognize that relationship and join us this evening to learn a little bit more about the program that we've put together with your outstanding doctors. So I'll roll it back to Andrea. If you want to make some broader introductions as we kick things off, please do. Go ahead, Andrea.
Yeah, absolutely. So as many of you have maybe talked to me on the phone, I'm the lead member advisor. My name's Andrea. So I'm the main person that you can call in and talk to, answer any questions, and it can help you sign up. So at the end of this, I'll also give my contact details so that way if anyone wants to sign up or has additional questions, you can reach out.
Great.
Susan?
Oh, hi everyone. Okay.
Well, do we want to, let's follow our agenda that we've established. I think we'll go in that flow, okay? And I'll kind of hand off and make introductions. Susan is with us. She's our National Director of Wellness. As Andrea stated, I'm Dean McElwain, the President, co-founder and the Chief Operating Officer of Castle Conley Private Health Partners. And we're joined by your favorite doctor, Dr. Tom Ziering. And I'll speak to how Tom and I came to know one another and also how, absolutely picky we are about who we partner with and how we had to chase Tom to come with us. And we couldn't be happier that he's chosen to stay with us. In a previous existence, he was with another concierge company, and we're very excited to have him join us and be part of our partnership team. So without further ado, a little comment on Concierge Medicine, and some of you may be familiar with it. Either you yourselves have had a concierge membership in the past, or you have friends who have a concierge relationship with their physician. We use the words concierge and membership interchangeably. And as I've been in this field for over, I guess, 15, 16 years now, and I've seen it evolve, and I've watched how the value of the relationship between a patient and their primary care physician has increased over the years. And I don't say that in a small way. As I've watched, and Dr. Zehring has watched, and the rest of our team has seen, there's been a real erosion between the way society and the way healthcare in general, in our country in particular, values the power of that relationship. The essence of the trust that you've established with your physician and your personal physician cannot be discounted. That connection and that personal attachment and the trust and the relationship and all of the ability to communicate around that trust is so important. And as we built our company, we have endeavored to add physicians who are very special. And as we came to learn about Dr. Zehring and understand, the values that have driven his practice for all of the time that he's been in practice, we understood very quickly and clearly that he is a great match for the core values that drive our company. At its inception, our company and the brand Castle Conley has been around for over 30 years. And it's a brand associated with excellence. We are known in its entirety. The Castle Conley brand is known as a company and a movement that has connected patients with top physicians for all of that time. We are charged with identifying and curating high quality physicians and letting consumers and folks know about their capabilities. So it's a natural flow that we were connected with Dr. Zehring and collaboratively established our movement into the concierge space with him. And because of that, we're able to deliver a whole menu of services that we will talk about in detail as we move through the webinar this evening. And so, Concierge is designed to provide patients a membership experience and connection with their physician. And that connection allows for a few discrete services that are not traditionally either medically necessary or delivered in a traditional patient-doctor relationship. Those services are really focused around a few areas: convenience, connectivity, collaboration, and personalization. You're not just a number. You are unique, special, individual, who your doctor knows in a very profound way. And because of that, so much can be handled very efficiently, effectively, and with the attention and compassion and understanding that you deserve. You can contrast that with the 6 to 7 minute visit that you might have if you go to a health center, or you go to a larger group, or you go to a more traditional setting, and that's only getting worse. Again, the power of that relationship, even from a clinical standpoint, time and time again, the literature has demonstrated the patient-doctor relationship, when it exists, when it's established and trust is a key part of the mix, is the most effective way to handle your problems, and most importantly, to prevent those problems as you go down the road, and particularly as life evolves and we get older and problems become more complex, comorbidities, meaning multiple problems arise. It's so important for someone to know your history and to know you as an individual. And that's really the essence of what Concierge is about. It's about the strength of that personal relationship with your physician, having a connection with them that is really not interfered with, that is direct, where you have an exceptional amount of convenience, connectivity, and an ability to plan and work towards your preventative goals in a very concrete way. So that's my my spiel on Concierge and why we believe so strongly in its effectiveness. But again, I can't reiterate the excitement that we have around our partnership with Dr. Zehring, and we are here to support him and to elevate his capabilities. This is not about us or me or our company at all. We are here to make sure that your doctor has everything that he needs, remains independent, by the way. That's also important for you to understand. He doesn't work for us. We don't control him. He runs his practice. We are providing him with a tool set and a set of capabilities in order to give you the very best experience. And we prove that every day because the members that we have practices all over the place, and that's another benefit that you have access to. We have a network of over 58,000 Castle Conley top doctors across the country. And if you're traveling or you need to see a specialist, we have the ability to connect you with them, whether you're at home or you're away. But, for all of our physicians, it's about them, and it's about our ability to make them, create an opportunity for them to deliver the services that you need in exactly the way you need them. So without further ado, I'll turn it back to Andrea, and she'll make some introductions as well.
Thank you, Dean. So next, I just want to introduce Susan. She's our National Director of Wellness, and she'll just give a brief overview of basically the amenities that we offer, aside from Dr. Ziering, just the wellness program that she provides.
Thank you, Andrea, and I hope everyone can hear me. So I will share my screen quickly and give this overview. Bear with me. Okay, so just to quickly on what we call the Send Solution Wellness Program. When you join Dr. Ziering's membership, you are entitled to all the benefits of the Send Solution Wellness Program. and that is what I'm the director of. So what is Send Solution? It is Castle Connolly Private Health Partners wellness program that's designed to enhance your overall health and well-being, and it's under the 4 pillars of sleep, exercise, nutrition, and stress management. So that is SENS. So all of the information that comes out and that members receive when it refers to SENS, Send Solution, that's the umbrella of our wellness program, where we really focus on these 4 pillars of your overall health. So what are the benefits of the Send Solution Wellness Program? You, as a member, get access to a SENS health coach. Oftentimes it's myself or another health coach, and it's very collaborative with Dr. Ziering, and that's really the main focus, back to this personalized care and collaboration that works on the preventative side of your health as well. So a health coach, what does a health coach actually do? That the role or that relationship is all about identifying unhealthy lifestyle behaviors, if you have any, and then setting realistic health goals. Then you work on an ongoing plan to improve your health and really set and reach those wellness goals. In addition, as part of the wellness program, we put together some very well curated events for members. They've all turned to webinars recently. And if you are already a member of Dr. Ziering's membership, you'll be receiving or probably already have received invitations. I really encourage everybody to join in, check out what they're about. I have one next week that will be on nutrition and how it impacts your mental health. So in any case, these wellness events include webinars, podcasts. There are quarterly newsletters that go out, lots of recipes, blogs, very supportive health tools and information for all members. And then we have what are called affinity partners. And these are companies that offer various products and services and that also support your overall health and well-being. So what some members say about the health coaching portion of the wellness program in particular. So I mentioned that it is very goal-oriented. And of those members who set an exercise oriented goal, 75% of them reached a goal after just 2 coaching sessions. And when it came to a diet or nutrition related goal, 77% of members reported behavioral changes. That could just simply be eating more fruits and vegetables. It could be weight loss. It could be any number of those goals that were set and reached. So that's a very, very short summary of what the Send Solution Wellness Program encompasses. And again, my name is Susan Greeley. I wanted to put my information out there. You received lots of information from me. I hope you do take advantage of it if you become a member, or if you are or become a member of Dr. Ziering's membership. So thank you. And I will take questions at the end as well.
Thanks, Susan. So now we'll basically just have Dr. Zehring and Dean just talk a little bit together. I know you've all been waiting for Dr. Zehring to start talking, so I'll let you two take it away.
Great, thank you, Andrea. And I just want to answer one quick question. There's some Q&A questions that are coming up on the question board. I'm just going to jump to that for a quick second. A very precise question one of the folks had was, what's Castle Connolly's experience in this space? So we've been around about 8 years now, and we have practices throughout the country. We have about 60 partnerships in existence, and we're very strongly based in the Metro New York area. We have over 35 practices in the New York Metro space, as well as in Morristown. Along with Tom, we have Cardiology Associates of Morristown, so some of you may know the docs over there. Is quite a large cardiology group that we've been partnered with for about 5 or 6 years now. And in this space, we are regarded really as a service delivery leader, because most of our competitors that are in the concierge space are really focused on just membership, sales and marketing and doing the billing and that type of thing. But what we've endeavored from the beginning is to really provide an ecosystem of support for our physician partners so that they have, as Susan mentioned, the wellness program, the SENS, the health coaching. Each and every one of you who becomes a member, I want to reiterate, has the ability to have a personal health coach that will help work with you to establish your goals and then help you reach them. And that person is really there to be your advocate and really work closely with you. You also have navigation services through our navigators. Again, I want to reiterate that our capabilities are broad because we have, as I said, over 58,000 specialists across the country that we can help connect you to and navigate you to. So if you're having a problem, in collaboration with Dr. Ziering, we can help find that correct specialist for you, establish the appointment, and typically, more often than not, get you expedited scheduling so that you can see them quickly. And we have a whole other range of member experiences available, including a lot of content that Susan provides. Without further ado, let me introduce Tom and have him say a few words, and we'll get into a good run of Q&A, and I'll try to stay on top of the questions as they come in on the Q&A board as well. So Tom, tell us a little bit about why you've decided to go in this direction, and give us a little bit of your perspective on what you see as your future and evolution of your practice.
Okay, well, it's pretty interesting because I started with a private practice. I've been in practice for 30 years. It was, at the time, that was the way things were done. And we had to deal with insurance, which was a little bit crazy, but first there were HMOs and there were PPOs. So I've seen all that. I joined Concierge with a different company along the way because it seemed like a valuable tool to enable me to see patients in a reasonable period of time. It was nice and it worked. It was lacking a lot of what PHP has, because it was really a financial decision. Then I went on to leave that and go to a corporate medicine situation, and I was just miserable. Those of you guys who know me saw it in my face and kept saying to me, "Are you okay?" I could not see 23 patients in a day. It's not the way I was trained. It's not the way ethically I believe medicine should be performed. 95% of a diagnosis is in the history. So to have 7 minutes, yes, for a sore throat, but to have 7 minutes for someone who comes in with belly pain that really might be something either quite intense and requires absolute focus. Maybe I need an x-ray, maybe it's really about stress. And I just felt I wasn't given the time that I needed. So interestingly enough, just as a side note, I was raised and delivered by a family doctor who took care of my parents and my grandparents. So I was introduced to family medicine a number of years ago. I won't say how long, but I love the concept. It was really fun because we were in his home, and I do remember running through the rooms trying to avoid the injections. The reason I chose Castle Connolly is the organization itself. The brand has been known for years. Castle Connolly has always had the thick books on the top doctors in the country, and I was honored for the last 28 years to be in that book. And it has been a book not just for us to feel proud of, but it's been a book for doctors and patients to research physicians. So when I met with the Castle Connolly people, I was thrilled because it meant a lot to be asked to be part of this organization. And this organization is very different from what I've experienced before. We're a team. I don't feel like I'm with a business. I feel like I have a support service. We all meet. Something that I've never seen before is we do our own Zoom meetings, and a lot of the people in the group are the top specialists in their field. So when we get together to have a meeting through Zoom, we're also getting taught, we're getting education from the top leaders in the field. When COVID came out, we had an infectious disease person from Montefiore, and she was wonderful. She was filling us in on how we should protect ourselves, what we should look for in patients, and it was fascinating. It's certainly much better than reading a magazine. So there was that support for physicians that I really liked. Plus, my attitude is body, spirit, and holistic thinking. And the whole setup of Concierge in this group is the same philosophy. We look at everything. And so I'm not just able to take a medical history, an emotional history, a family history, but I have the ability, and I've already worked with Susan on one of my patients, to have a staff to reach out to so I can go even one step further. So to me, it's medicine that's being practiced the way it should be practiced, because I'm old school dinosaur, and happen to love what I do. Those of you who know me, I love this field. It could never have been a better match. But to be with Castle Connolly, everybody's likable. Everybody's friendly. Everybody's there to help me in terms of what I'm doing. So I feel the support of that. And it gives me the time to spend with patients and the time to research. If there's something I need to look up, I have that time to do it. So I met Dean, just a great guy, and we hit it off right away. And I gotta say, it just has been one step to the next, has been really easy, really nice. They understand my focus, I understand their focus, and it's a team. I'm not a follower. Those of you who know me, I'm a leader, and this allows me to practice medicine the way I want. And Castle Connolly gives me the name of an organization that I can use to reach out anywhere. If I need help on a case that I'm not sure of, or as Dean said, if we need to use a doctor out, say in Florida, a lot of my patients are snowbirds, I have that availability. So it's really, it's all encompassing. It covers everything that I believe as a physician should be. And that's really it. I've been nothing but impressed since meeting with the group and joining with the group, and I've been very happy so far, as have a lot of my patients been happy so far.
Tom, you mentioned your prior experience having done the concierge program earlier in the hybrid model, and I think it's important for folks to understand the difference at this point in time. Now that you really have moved to a full concierge model, before you had really a couple of populations to attend to. You had a concierge group, and then you also had your traditional engagement group. So maybe if you can comment on, the reason you've chosen to kind of go fully focused on the concierge side at this point in time, and what do you see as the strengths focusing on that?
That's a great question that you bring up, Dean. When I did join with the prior concierge group, like you said, there were people that signed up to be concierge, and there are people that basically stayed with their insurance and didn't join concierge. I'm ethical, and to be told by an organization, your concierge patients get X and your non-concierge patients get Y. Maybe they don't have access to certain things. The concierge patients got a few extra little tidbits. It was really not much. And I just had a problem with that. I really did. It just didn't sit right. And the practice boomed because of it. But I had this little Robin Hood, I call it the Robin Hood complex, which I felt like I was robbing from the rich to give to the poor. I gave everybody the same amount of time. The concierge company didn't know that, but everybody got the same amount of time. And so with a level of patients reaching to 800, 900, and me wanting to spend half an hour to an hour going over whatever the issue was and having the time to do it and not feeling rushed, the problem became everybody got the same amount of time. So I'd go to work at 8 o'clock and I would finish at 9 o'clock. And that was a problem for me because when I was done, I was exhausted, got about 4 or 5 hours of sleep and was back working again the next day. And while I enjoy healthcare for patients, it just wasn't fair. It wasn't right. And the impetus for leaving was joining with the corporation, but I have to say that I wasn't happy with the way things were set up, and I felt bad for the patients that weren't paying. So when I joined with the corporation, it was an easy step out and what I thought would be a way to slow down and have time with people. And that unfortunately was a disaster. That was 23 people a day. And there's no way that you can talk to patients, figure out what's going on in a 7-minute interview. And we were basically glorified triage nurses. If someone had a cold, they had to go see the respiratory specialist. You could only do one thing at a time. So I think I'm all over the place, Dean. But I do want to say that the hybrid aspect for me, it was an interesting foray into concierge medicine, but it just wasn't right. You can't treat people differently.
Yeah, we find that it's in some instances it can be acceptable on a smaller concierge panel, but more often than not, it really becomes very difficult to give all the attention you need. So our recommended model, as you know, is to really focus on having really a very small group of concierge patients that you give all of the services in a continual way. And really focus on their needs. So that's an important point. And by the way, everyone, this is Zoom. So as my chocolate lab starts to tell me it's that time of night, I'll beg your forgiveness. And maybe Bentley will appear.
Bentley keeps throwing toys at me. Just for those of you that are my patients, you know Bentley, he's been throwing his lamb at me, trying to get my attention through this whole thing. So if I turn my head and go, stop it, it's to the dog, okay?
So that's our interlude of levity here for a second, maybe. But the real important point here is that, again, it creates an environment where Tom can focus on you as the single patient in front of him at that given point in time. And thinking about the 20 other people that are coming in the rest of the day, or the 4 people that are backed up in the waiting room waiting for you. And as you've more recently, you have your practice running at a certain, profile, but realistically, that's not sustainable either. It really, you're trying to operate a small practice in very challenging circumstances. And the only sustainable model is to get into a concierge membership focused program. So, I think really, realistically, it's important to focus on that small group of patients and create an environment that allows you to do that. So I'm going to mute for a second, but Tom, if you would kind of comment. Sorry about that, folks. If you would kind of comment on what you see as the benefits of the membership deliverables that we've come up with together, whether it be, having the more time, having, kind of continuous connectivity to your patients, just a day in the life of a concierge physician, you can already comment on that. And, maybe you can give us a couple of key case examples where you've been able to intervene in a very convenient way with your patients, keeping them from having to come into the office, which is also more important than ever, but also solving their problems quickly and getting to them in a quick, efficient way. And when you do that, I'm going to put Rocket out.
Bentley, chill. Okay, so I think I just lost your question, Dean. This is what's happening as I'm getting older. But the reason that I feel that this is a good model, right now we're dealing with COVID. I have learned to be technologically savvy, although I'm not thrilled with it in terms of talking to patients and seeing patients. I need to touch patients. I need to hear what's going on in their lungs. I need to hear their hearts. So it's very hard to do telemedicine, but of course, the way things are right now, this is the only way to do things. So our office is following a protocol where we only have one patient in the office at any given time. So there is no wait. And ideally, what I would like to have is a very similar scenario. Now, people require different times based on, or amount of time based on what the issue is. So where I feel it's best is half an hour, 45 minutes, an hour, hour and 15 if it's necessary. Some problems require more listening, more questioning. I'm a very big believer in how emotions and stress have an effect on your health. So it's not just, well, why does your arm hurt you? It's more questioning about, well, what's going on in your life? And what's new? Are you having any new stressors? Are you feeling depressed? Are you feeling anxious because of COVID? And everybody, I think, is feeling this terrible sense of being shut in. So our office took to staying open as much as we could. We closed for 1 week, and then we opened up with the guidelines of the American Medical Association to protect ourselves and to protect our patients. But the flow actually was quite nice. Nobody waited. We didn't have a lobby. People stayed in their cars and we would call them in. But it was very nice because I had the time to spend with people, and nobody felt shortchanged, because what we would hear is if someone had to wait, their their statement to my staff would be, it's fine, because I know he's giving that person the time they need, and I know he's going to do the same thing for me. So concierge really fits in line with my philosophy about medicine, and I teach medicine, and I try to bring across the tenets of, look, the most important thing is listening. You can hear your patients, but you got to listen to what the underlying issue is. You can't do it in 7 minutes. You can't do it in 10 minutes. You can't do it in 15 minutes. And I have a relationship with a lot of my patients that they know about my life. I know about their lives. It's a safe, non-judgmental environment. And I want to keep it that way. And I really don't want to be told what medicines I can and can't prescribe. I want to be able to look at lists of medications that people may be on, especially seniors, and say, well, we don't need this, we don't need that, because medicines have toxicities. So I like that this model is going to be fair and balanced. There's going to be zero inequity in terms of people paying a concierge fee, but for that fee, we're getting all the services that concierge offers for us, which is pretty wonderful. I've already taken the meditation Zoom that Susan put out, which was really great. It allowed me to slow down my head for about 5 minutes.
Happy to help.
I think you've touched on several of the key aspects as to what the benefits are for your patients. And I think another one of the questions that came up is, are you going to be keeping your wonderful staff that you have, the team that you've put together? And it's important for folks to know, we are partnering with Dr. Ziering to support the concierge membership services and deliverables. His office is remaining exactly the same. His team, Dr. Zehring, still runs his practice. He doesn't work for us at all. We don't control his practice at all. Again, we're really here to help provide these amenities and other services that are associated with concierge programming, as well as to help really be a conduit for you. Should you need something, we are here to provide that extra navigation service, the health coaching services, and all of the other support services. We'll help you sign up your membership. We'll help maintain your membership for you. You want to bring family members in, we'll help with that. All of those key aspects of maintaining your membership are our responsibility, so that Dr. Ziering can really just focus on taking care of you. I'm going to wrap that into the understanding that some of you may say, and I've had some questions that have come through again, I'm already getting a lot of this from Dr. Ziering. I'm already getting this from Dr. Ziering. How is that going to change? And, why should I pay more for that? And that's a very common question for docs who, what I ultimately call are really practicing concierge medicine already. They're just doing it in a way that's economically not sustainable. They can't run their small private practice in a way that allows them to give that service for a long time. It's very challenging when you think about it being that you have to kind of get a certain number of patients to come through your office on a daily basis. And with all the complications of keeping your office open and really operating your office, it's very hard to be in that mindset where it's a transaction, where you're seeing someone and they're coming in for a visit versus a relationship. So what this does is it moves the relationship towards one that's ongoing. It's not so much about just when you see that person for that visit. It's really about being at their side, really in an ongoing fashion. And that's really the wonderful thing about concierge. It is very new for a lot of folks in this Zoom meeting here. But when you talk to our members, folks who are members of ours and have been members of ours with our different practices for years, they will tell you they wouldn't trade their concierge membership for anything. We try to make it economical. We try to put it at a very value-oriented price point. There are some concierge programs that are $5,000, $10,000, $15,000, and $25,000 a year. And I will tell you, they're not getting Tom Ziering for that. So, it's a situation where you're getting an absolutely fantastic physician who values his relationship with you, and that has to be appreciated fully. Another set of questions that comes around insurance and how you're going to continue to deal with the billing. So maybe you can comment on that, Tom, and how you're going to, and that's really in your wheelhouse as to how you're going to deal with the insurance side with the billing for each, visit that folks have in addition to their concierge relationship.
Sure. Well, before I even do that, I just want to give a shout out. All my staff members, we're all refugees from corporate Medicaid, from corporate medicine. None of us were happy in it. So you guys know Carolyn, you know Kelly, who handles all the billing, you know Nicole. Everybody's on a first name basis, so you feel comfortable. We've decided to drop our fees between 15 and 20% based on what we're doing to try to make up, and in many instances it does make up for the concierge fee. So you won't be charged the same amount that you have been charged in the past. We're also, and we've been doing this for a while, we're sending people out to facilities that accept their insurance. For instance, x-rays. If I need x-rays done, if I need a surgeon to operate on someone, I'm going to find the best surgeon, and I'm going to try to connect you with a surgeon that is in your network. We will do all the blood in our office because I want to keep people out of the labs. But if you want to save money on drawing blood and go to the lab, that's fine. So we'll offer you all sorts of options on ways to save money. It's not like S&H green stamps, but I will go out of my way. Same thing has happened with vaccines. They're very expensive. Now pharmacies are offering them. So what we're doing is saying, look, you know, let me write you a prescription, go to your pharmacist. It's not going to cost you anything to get a vaccine that's going to cost me $200 to purchase, and then I have to charge you. So that's one of the ways we're trying to make things easier, is that way Medicare fees don't change because they're ceiling by Medicare. Medicare, we will be submitting, that's Kelly's job. She submits all the Medicare billing so that you can get paid directly by Medicare. The fee is upfront as it's been done before. We are still out of network, but we will give you forms that all you have to do is sign and drop it in the mail. It will be a form that's ready and prepared and ready for your insurance company. And those of you who have worked with us have seen how nicely that works. So all you do is drop it in the mail, and your insurance company will mail you back whatever is included in your out-of-network benefits. So that's kind of how we're working it right now.
Some folks are asking about house calls. What's your plan? And
sure, feel free to come over for coffee and play with Bentley anytime you want. House calls for me are one of the joys of medicine. I remember when I had a high fever, the family doc came over and took care of me. It was pretty hysterical. I do house calls. I obviously, for logistical reasons, I can't do them for everybody, but a lot of my seniors can no longer drive or they're quite ill. I will go to their house. It's time out of my day, but it's enjoyable time actually, because you get to learn more about a person by the way they live. I also, patients that I've known for years, I've been in practice for almost 30 years. People that were in their 60s and 70s have aged. If they become ill or hospice is required, they're not managed by their oncologist, by their radiation or their surgeon. I'm the one who manages end-of-life care. So I go to the house. I don't, even if people can drive, I'm going to go to the house. I'm going to make sure they have everything they need. I'm going to make sure the visiting nurse has evaluated to make sure everything needs to be put in place. And I'm still going to be in charge. And so I'll be the one to share, this is what's happening. Let's talk about it. What do you want? What don't you want? And we can do it privately or have family members. Bentley always comes on my house calls, and I can't tell you how much people love it when he jumps on the bed. It's hysterical with him. The other thing is I will do house calls. There is a new program that has arisen. People have always been very concerned of having the choice at the end of their life to make the choice to end their lives if indeed that situation comes up, that they feel that their life has just not been where they want to, they're unhappy, they're uncomfortable, they're in pain. I'm now one of the physicians that's part of the program. It's called the Maid Program, which is medical assistance in dying. It's an amazing program that's out there. It's in its infancy. And I can offer that to those of my patients that are within 6 months of their demise based on hospice. What is coming forward and down the pike in this is at some point now we're dealing with dementia. So someone has to be able to make the decision that they want to end their life. If someone has dementia, they can no longer do that. So what's coming down the pike right now are forms and means of addressing when someone's well, what to do if, should X, Y, and Z happen. I want my doctor to be there. I want my doctor to help me with this so that my family trusts, they know what's going on. And I think house calls really are pretty amazing. They're really nice. Unfortunately, I can't do them every day, but we fit them in. If it's an emergency, we direct people to the hospital. But elderly patients that are sick, I have no problem. I have no problem going on it. It is fun.
Kind of to come in for a landing here and kind of finish on 2 points. One, you kind of had to tell folks why you think it's important for them to join. Maybe I think kind of wrap it up and focus on that. And then also for the folks who don't join, how will you deal with them and how will you continue to have a relationship with them moving forward? I think it's important for folks to understand both sides of that. And by the way, everyone who's attended and other folks who've added questions this evening, we will, if we haven't gotten to your questions, we have all of the questions recorded. We will make sure that we get back to each and every one of you. So if I haven't or Tom hasn't answered your questions fully, rest assured that we will answer some of your questions that are very personal. We'll answer them very directly and in a broad way. For those more general questions, we will also put that out there as well. You'll also be receiving further communications from us, of course, and we'll make sure that you have everything that you need. So, Tom, if you would focus on those 2 components,
Sure.
Why they should join. Yeah.
Those of you who have known me, and I've had relationships with a lot of families for 28 years, the kids that I took care of are now bringing their kids to me. So there's that level of trust. Without singing my praises, I'm highly ethical. And I believe that in medicine, it's really important to present to your patients, to the families, okay, this is what's going on. I can offer you A, B, or C. If you choose not to do A, B, or C, it's your life. I'm not going to tell you what to do. I'm not judging you. But we work together in a collaborative method to come up with a plan of action that will work for you. And people always comment on that. My doctor never explained to me what this is about. My doctor never told me what it means that I had a blockage in my heart. And people know that I'm very focused on prevention. So physicals, they're not really an option in my office. They're absolutely required. So I can pick up a problem before it becomes an issue. So I think the people that have found me to be trustworthy, to be there when they need them, and to go over and explain during an exam why I'm listening to a heart, why I'm listening to a neck, I enjoy teaching. And so those people that know me know my style. Certainly, I believe they trust me. And if there's ever a question, the question doesn't ever go unanswered. So for those of you who choose to stay with the practice, the only thing that's going to change is we're going to have even more time to sit down and talk, and no one's going to feel rushed, which is healthy for everybody, not just patient, but also for me. I don't want to have one foot out the door. Those of you who know my office, it's set up like a living room. Every room is a living room. All the stuff is from Home Goods, great deals. Nothing looks like a doctor's office intentionally. That's why we have the dog, we have aromatherapy. So you'll be able to have multiple issues dealt with at one time. I do GYN, I take care of the LGBT community, both for health and for transitioning. You're not gonna get that from any other doctor other than going to a clinic, and I don't wanna run a clinic. So for those of you who know me, you know we can deal with 10 problems in one visit. You don't have to keep jumping from doctor to doctor to doctor. We'll go through all your issues, and if we do require more time or you need to come back for something, no big deal. We'll fit you in. We'll get you in within a day or two if need be. We're keeping open slots. Those of you that choose not to join me, I'm very sad to see you go. I will do everything that I can to make the transition easy. Make sure you have your medications that you need. Make sure that when you found the doctor you choose to go to or the organization you choose to join with, that those people that will be caring for you have electronic copies of your records. So we're gonna make it as seamless as possible. I certainly hope you stay with me. That goes without saying, but I do understand some people are uncomfortable with it. just so you know, we will be accepting patients afterward as well. We're going live on October 12th. But I've told a gentleman the other day, and he said to me, I really like the way you work. I feel comfortable with you. I trust you. But I really want to go to X, Y, and Z Corporation because they're going to be in my network. What do you think? And I looked at him and I smiled and I said, you'll be back. And he laughed. He said, you're right. I probably will, because he asks a lot of questions. So that's what I can say to those people that choose not to join. And when people ask me, you know, who do you recommend? I don't recommend the corporations because it's a mill. So the only other doctors I can recommend, if I recommend doctors, are also in concierge practices, so they can do this. So it is up to you whether you want to join or not, and I hope you'll stay because of the trust we've established. I assume everybody has other issues, and certainly it makes sense. And it's something to weigh, but good health is not something to throw away. Just briefly as an aside, I was misdiagnosed at 25 with basically a brain tumor. And it was because nobody listened to me. I had 7 doctors that would walk in and out of my office, and I was told I had 2 months left. Being in medical school, my plan was to go to Italy and max out all the credit cards until a family doctor said, wait a minute, all his organ systems aren't working right. Let's sit down and make sense out of that. And it turned out I had an absolutely benign autoimmune problem that disappeared within a month. So sadly, I had to go back to medical school, but it helped me figure out my career. And those of you who know me know I have a passion for medicine. I love what I do. I couldn't have picked a better field. So I know you pick up on that. I hope that's something that you enjoy. And you have a regular person. You don't have a doctor in a white coat. Fortunately, now you have a doctor in scrubs and protective gear, but I try to make things as comfortable as possible for everybody.
Yeah. No, and again, I want to reiterate how lucky we are to have our partnership with you. You know, the key benefits are there. You know, the access, the ability for same or next day appointments, no waiting time when you're in the office. You know, it really to have all the time that they need with you in the office when they're actually there. And then, you know, really to be able to connect with you 24/7, hopefully not at 3 o'clock in the morning all the time, but 24/7, you know, and really we have the telemedicine capabilities now and secure messaging that makes it even more convenient for everybody. When you look at that and just having that, you know, level of advocacy and connectivity and really control over your health, you know, the value is so strong for the very small fee that you're asking for, and we are. You know, when you think about that cup of coffee a day that it might replace, that's really what it comes down to. You know, that's a good trade-off. So, you know, we're excited to welcome all of you as members. As many of you as can join, we'd love to have you, and you'll find as personal an experience as you have with Tom, you'll have that with me and our entire staff. It's not unusual for me to get an occasional call, and for us to be able to reach back, for me personally, even get a call from a member and fix a problem if needed. So we're all here for you, and I want to make sure that we let you know that, and we'd be honored to have you as members collectively.
Can I steal just a couple of minutes to talk about something that's really exciting to me? Now with the technology, there are doctors that are in hospitals, doctors that are not in hospitals. Now hospitals have been run by hospitalists that basically will see you. You have specialists running in and out of your office. There is something amazing that has happened. We are now partnering with Atlantic Health, myself actually, and I will have access to your records while you're in the hospital. So with the specialists running in and the cardiologist and the pulmonologist, and they only have 5 minutes with you and they're running in and going back and forth, I'll be able to access your records from my office, go through it, and then I can have a consultation with you and explain it all and say, this is what's going on, this is what I'm seeing, whether we do it by computer, by iPad, by phone, or by FaceTime. So to me, that's kind of exciting because it puts me back in the hospital, but I'm out of the hospital and I can go through it. And a lot of people feel that disconnect from their doctors. They're just kind of thrown in the hospital and they don't know what's going on because nobody explained it to them. So I see that as one of the more exciting things that's coming down the pike. And we are probably going to be connected with the hospital by next week. And then, of
That's
course, the
great.
Zoom stuff is easy.
Yeah, that's fantastic. And that kind of quarterbacking and advocacy and connectivity, you know, when you say, you know, what's it worth, as the old saying goes, it's beyond priceless. When you really have a problem and then you have that level of advocacy and they have that connectivity to you, who they know is watching out for you and is going to say, don't worry, I'm on it. I'm paying attention. I'm watching what everyone is doing. I'm going to make sure that everything is followed carefully. I'm going to make sure that if we can get to the bottom of this quick, we're going to do that. That's irreplaceable. It's really something that is something when you need it, you'll pay dearly for it if you had to. So folks have to kind of remember that. And I have countless, you know, reports from members of exactly that type of experience and their value of the membership because of that. So thank you so much, Tom, for taking the time tonight, and thanks to everyone who joined us. I'll turn it back to Andrea. Andrea, you can let them how to reach you and deal with their membership questions and how you can connect. And there's Bentley. Rocket's outside, so we won't get to say hi to Rocket tonight. But hi, Bentley. So Andrea, without further ado, I'll turn it back to you, and you can sign off and say good night, everybody.
Perfect. So thank you, everyone. As Sean mentioned in the chat and everything, please don't hesitate to contact me if you have any questions. I'm actually going to share my screen so you have the information. You can email us at zeringmemberservices@ccphp.net. This is also the phone number to reach me or one of our other member advisors. So if we didn't answer any of the questions that you had tonight, please don't hesitate to reach out. I'm usually pretty quick to answer emails as well, so you should get your response right away. So thank you, everyone, for attending.
Thanks so much, everyone. Have a great night.
Enjoy. Be well.
Take care
Okay,
now.
thank you. Bye, Tom.
Bye, guys.